मैं लिंक इसमें खोलूंगा। Hello, hello, hello. Hello everyone, good evening. Shivam this side. Today we will discuss the FMG exam question paper. We will discuss some of the topics or some of the questions which came that way in this exam, and I hope so everyone have a good exam this time. And for sure this time the passing percentage will be high as compared to the previous batches. So everything all right? Even video clear? Everyone in the chat and confirm the audio and video is clear. Audio and video clear? Sound problem? Our sound is good. Hello everyone, Dr. Shivam this side. So today we will discuss some of the FMG questions which came on July 2024 exam. So I hope so you have a good exam this time, and I hope so everybody will pass this time with a good percentage, and the passing percentage will be high this time for sure, because as for the now review, the paper was like easy to moderate, or like we can say moderate exam. The first part was like little bit easy to moderate, but the second was like something moderate was given intuition questions in the part 2. So let's begin. Everything all right? Sound and video quality. So we'll begin with the anesthesia. So as we all know, the Malampatti score, the first question was like, it is a previous question we can say, or the PYT we can say, or the most important topics we can say, the Malampatti. So the question was, what is the Malampatti score used for? As you all know, there are 4 scores depending on the Malampatti score: grade 1, grade 2, grade 3, and grade 4. So which is, it is based on like the difficulty of the endotracheal intubation, or we can say that it is based on the airway management. Like when giving the anesthesia to any patient, we want to see, when we are giving the anesthesia to the patient, we want to get when we are giving, like, there will be any difficulty in the airway or not for securing the airway of the patient. So the answer here will be difficulty in the endotracheal intubation. As we all know, there are 4 grades of the Malampatti score: grade 1, grade 2, grade 3, and grade 4. In the grade 1, all the stressors are visible. In the grade 2, all the stressors are visible except 1 or 2. In the grade 3, only the few stressors are visible. And in the grade 4, all the heart palate is seen. So, as we know, grade 1, grade 2, grade 3, and grade 4. In grade 1, all the structures are visible. And in the grade 2, all the structures are visible except 1 or 2. And in the grade 3, only the few structures are visible. And in grade 4, only the heart palate is seen. I hope so this question was easy for you and you have done it correct. So let's go to the question number 2. It was, question number 7 was, which of the following IV anesthetics acts on the NMDA receptor? As we all know, there are only one IV anesthetic agent which acts on the NMDA receptor. The answer is ketamine. Other anesthetic agents which acts on the NMDA receptors are like nitrous oxide and xenon, which acts on NMDA receptor. Rest all like propofol, thiopentons, and etomidate, they act on GABA receptor. So this was a like easy question, or you can say a good question. So IV anesthetic which acts on the NMDA receptor is ketamine. The answer was like, okay, good. If you have done it correct, I hope so. Now move to the next question. So the following drug is the most common. It was asked which of the following drug is the most common used in TVA, as recalled by some of the students. But some of the students was saying the drug was asked which is used in the daycare surgery. So if the question was on TIVA or if the question was on daycare surgery, the answer would remain the same. As you know, the answer would be the propofol. Because in TIVA, it is termed as total intravenous anesthetic agent, in which no inhalation is required. In TIVA, only intravenous is given, no inhalation is given, or if the daycare surgery is mentioned or the TIVA was mentioned, the answer should be propofol only. In daycare surgery means the patient is admitted on the same day and discharged on the same day, not on the next day. It's only depends on the same day. If TIVA was there or daycare surgery was mentioned, the answer should be propofol. And as it is the most common, propofol, it is the most common used IV induction. It is used in daycare surgery. It is used in TIVA. And as you all know, as I already mentioned in the last question also, like the propofol and thiopental sodium and etomicidate, they act on the GABA receptor. So it was about propofol. So let's begin to the 4th question. But the question was about the adult cardiac arrest. It was about compression to ventilation ratio. Then adult cardiac arrest, if there was a presence of more than one rescuer. So the answer here should be 30:2. First of all, if there was more than one rescuer or only one, answer is same, 30:2. In adult, there is no need of more than one, or we can say two or three, or only one square. If only one square is also present, then the answer should be 30:2. But if it was a pediatric age group, in pediatric age group, you add 15:2 in presence of two square. And what are the other steps in ventilation to compression ratio? Is that there are 30:2 set, there are 30:2 in ratio of 4 sets in 1 minute. And what should be the minimum depth of the chest compression? That should be minimum 5 centimeter. And we should allow full chest recoil. So if in the question the adult was mentioned, the answer should be 30:2 only. But if in the question pediatrics age group was there, but it was not, but it can come in the next time, or the next exam, then the answer will become 15:2. So this was something about combustion to ventilation ratio. I hope so this was a good question. Let's begin to the next question. So which of the following comes under the ASA grade 1? So ASA means American Society of Anesthesiologists. In which, as we all know, there are 6 grading: grade 1, grade 2, grade 3, grade 4, grade 5, and grade 6. Grade 1 is for healthy patient, or we can say then there is no comorbidities. And grade 2 is for like any for mild disease. Grade 3 for moderate disease. Grade 4 is for severe disease. And grade 5 is for almost dead patient, almost dead or moribund patient, we can say, who will die without this surgery. And grade 6, as we all know, it is a brain dead patient used for donation, we can say, cadaveric donation of the organ transplant, we can say. So, as in the question was suggested of ASA grade 1, it has to be healthy patient. If it was grade 2, then the answer will become mild disease. Grade 3, then moderate. And in the morbid disease, or we can say a morbid patient, it depends on the grade 4 or grade 5. Like what was there, morbid disease or morbid patient was there. If it was a like morbid disease, it will be most probably will be grade 4. So I hope so you are understanding good. So let's begin to the next question. Question number 6. If any doubts or like if any queries you have, you are free to share. Or if you are like having any queries or any doubts, like this was not the question or this was not the option, you can type in the chat box. As you all know, these are the recall done by some of the students only. We can't go inside the exam, as you all know. So let's go into the 6th question. It was which of the following is used for reversing the effects of a muscle relaxation? The answer should be neostigmine. As you all know, we give neostigmine to reverse the effect of muscle relaxation. Like rocuronium, vocuronium, are the muscle relaxant we give, and for reversing the effects we give neostigmine. But some students were saying that answer should be atropine or like glycopyrrolate. We do not give glycopyrrolate or atropine for reversing the effects of muscle relaxant. We only give neostigmine, but in the combination of neostigmine, we give glycopyrrolate or we can give atropine. This is given in combination because, as we all know, neostigmine causes decreased heart rate. So when neostigmine causes decreased heart rate means bradycardia. So to counter effect the bradycardia caused by the neostigmine, we give glycopyrrolate or atropine to the neostigmine to counteract the effect caused by the neostigmine. So it is clear by everyone. It is not glycopyrrolate, it is not atropine, it is not acetylcholine, it is only neostigmine, which we use for the reversing the agents of the muscle relaxant. Now, let's do this question. Like, this was like a typical question, we can say, or it is like someone was in this question, we can say a tuition question, or we can a question which is not recalled properly, because someone are saying that topical word was mentioned, some are saying topical words is not mentioned. So it all depends if the word topical was mentioned or not. If only local anesthesia was asked for the cataract surgery, question was which of the following is a topical local anesthesia used in cataract surgery. If topical word was not mentioned, okay, we go by this first. If topical word was not mentioned and only local anesthesia was asked for cataract surgery, it has to be lignocaine, no doubt, because lignocaine is the most commonly used local anesthesia using cataract surgery. But if the word topical was mentioned, like which of the following is a topical local anesthesia using cataract surgery, then answer has to be proparacaine 0.5%. As we all know, the most commonly used local anesthesia is lignocaine. But if it was asked the topical local anesthesia, so it all depends on the word topical was mentioned or not. If topical was mentioned, then it has to be proparacaine. But if topical was not mentioned, then the answer is lignocaine. Right? But if it was a topical local anesthesia used in cataract surgery, then it has to be proparacaine. It all depends on the recall which you have done, guys. So as most of the guys were suggesting that it was topical local anesthesia which was mentioned, so the answer has to be proparacaine and not the lignocaine. Right, guys? Okay, let's begin to the last question of the anesthesia. I think there were around 7 to 8 questions of anesthesia which was recalled properly by some of the students. So let's begin to the last question. It was a question of local anesthesia. Like it was the case presenting question was there. Like a local anesthesia was given in the arm section, or we can say it was used like a Bayer's block, we can say. Local anesthesia was used for Bayer blocks. And in the last, mechanism of action of local anesthesia was that. So the above history was not useful because in the last they just asked for mechanism of action of local anesthesia. As we all know, the local anesthesia mechanism works by closing of the sodium channels. So answer here should be closing of the sodium channel. When the sodium channels are blocked, this prevents the initiation and propagation of the action potential. When there is no action potential, or we can say there is no action potential in the nerve, there is a loss of sensation of the nerve and the surrounding nerve where the local anesthesia was given. So, if you are getting this question, like the mechanism of action of local anesthesia was that. So it is by closing of sodium channel. What happens after closing of sodium channel? The sodium channels are closed. This prevents the initiation and propagation of the action potential. And then there is no action potential. This leads to loss of sensation of the nerves and loss of sensation of the nerves of the where the local anesthesia was given and surrounding the nerves where the local anesthesia was given. So it was like an easy question. We can say it was like a physiology also, or we can say pharmacology also was integrated here, and anesthesia of course because it is a local anesthesia. So it was a like integrated question from all of three. I hope so. If from this anesthesia 8 questions were there and you are scoring more than 6 plus, you will definitely get a good marks in FMG score. Of course, because anesthesia was one of the scoring subject in this sem, we can say, because there were 8 questions of the anesthesia, and last time there are like ये question आया था, हाँ questions सारे ही आए थे. All the questions came on. This is the recall only, guys. This is not the questions which I have made or which anyone have made. These are the questions which have been recalled by the students only who have given the exam. So these were the 8 questions we can say which came in the anesthesia. So I hope so. Like more than 6 question should be correct for you guys, because it was like not that hard part of the anesthesia was asked. It was like a easy to moderate part of anesthesia was asked. We can definitely say that. Any doubts in this question? In this question of anesthesia, or we shall begin to the next part of ophthalmology. Okay, then let's begin to ophthalmology then. As we all know, this is the PYQ which came in the last time Jan 2024 exam. This came in this time exam also, July 2024 exam. So as we all know, this cataract, which caused by blunt trauma, is the only one and only the rosette cataract. The last time it was asked, in the last time paper, the question was asked, what type of cataract is associated with blunt trauma? Image was not given, but this time the image was given. So as we all can see, the good image of rosette cataract. Right, guys? So this is the rosette cataract. Chemistry, this is not snowflake, no sunflower. As we all know, sunflower cataract is KF ring 1. Where we can see the snowflake cataract? Anyone? Where we can see the snowflake cataract? Snowflake cataract is seen in diabetes. And Christmas tree, it is seen in myotonic dystrophy. Sunflower, KF ring, or Wilson disease, we can say. So the only cataract which is associated with blunt trauma is rosette cataract. So this was the PYQ, or we can say the most important cataracts, because it is asked every time. So I hope so you have got correct this one. You can't get it wrong, because if you have done this wrong, means you have not studied correctly. Okay, then let's go to the next question. Nerve defects causes lag of thalamus. First of all, what is lag of thalamus? Lag of thalamus is incomplete or abnormal closure of the eyelids. Okay, now tell me the muscle responsible. Muscle responsible for closing of eyes is orbicularis ocula, which is supplied by cranial nerve 7. So which nerve defect of the thymus? Straight answer, it is cranial nerve 7 nerve. So any facial nerve palsy, or we can say Bell's palsy, any palsy which is including this 7th nerve, will lead to lag of thalamus, and due to this it can cause exposure keratitis. The nerve defect of thalamus is cranial nerve 7 nerve. It's a direct question, we can say. It is, we can say this question was related to anatomy also and ophtho also, covered in both. Next question. How does WHO defines blindness? As we all know, according to WHO, the blindness is referred to as visual activity less than 3/60 in the better eye. The full definition of the WHO defining blindness is visual activity less than 3/60 in the better. It is not visual activity less than or greater than 3/60 in the worst eye, or we can say with a no correction eye. This is the full statement. Visual activity less than 3/60 in the better eye, not in the like the worst eye, or we can say the not corrected eye. It has to be the better, not greater than 6/60 or 3/60. This is the question of, like, we can say of PSM and ophthalmology. And okay, so guys, let's move to the next question. Which drug used in ADT can cause sudden vision loss or diminished vision? As we all know, in ADT drugs there are 4 drugs: isoniazid, rifampicin, ethambutol, and pyrazinamide. These are the first line drugs given in TB management. So it was asked which ATT can cause sudden vision loss or diminish. So the answer here should be ethambutol. If in this question ethambutol was not mentioned, but any other drug was mentioned, then what will be the answer? The answer will be isoniazid, because isoniazid also causes vision loss or diminished vision. But as compared to ethambutol, ethambutol is the most specific answer here as compared to isoniazid. Other drugs causing sudden vision loss or diminution of vision are like tobacco, ethambutol, chloroquine, methyl alcohol, and some other drugs are there which causes sudden vision loss. But the answer here should be ethambutol. It is related to, it is a PYQ question. Last time also, Jan 2024 exam, this question was the exact same question was here. Sudden vision loss or diminished vision, also should be ethambutol. Next question of the ophthalmology. What type of local anesthesia is used in cataract surgery? As suggested by some of the students, topical was not mentioned. As you cover topical local anesthesia of proparacaine, but here the local anesthesia is mentioned, not topical. The answer should be ligno. We have covered both the aspects. As you covered both the aspects of this question, if topical was mentioned and if no topical. If topical, then proparacaine. If not topical, then ligno. This we have already done in anesthesia part. I won't have to explain it again to you guys. Oh, next one, the next question. What could be, okay, let's do this question. What could be the cause of acute sudden painful diminution of vision with vertically oval pupil? As we can all see, there is an acute sudden painful diminution of vision, and as mentioned, it is vertically oval pupil. The answer should be angle closure glaucoma. How? Let's explain it. In acute primary angle closure, or we can say acute congestive glaucoma, when there is full 360 degree, blockage, the angle is closed, the angle is closed, and the IOP pressure increases, due to which there is corneal edema, and due to corneal edema there is painful diminution of vision, and due to the painful diminution of vision there is vertically oval pupil. So it has to be angle closure glaucoma. As the other option mentioned, like optic neuritis or cataract or CSR, we can see sudden painful diminution of vision, but we cannot see vertically oval pupil. For vertically oval pupil, it has to be angle closure glaucoma only. Because in angle closure glaucoma, as we can see in acute primary angle closure or in acute congestive glaucoma, there is full 360 degree blockage, and full 360 degree angle is closed, and due to which the IOP or the intraocular pressure is increased, and due to which there is corneal edema. Due to corneal edema, we can see there is a painful diminution of vision. In that case, the pupil will be vertically oval. Understood this question, guys? This was like a tricky question, we can say, but not that much tricky as compared to other questions which came up like surgery and medicines and other subjects. This was not that hard, but we can say it was a medium question, not that easy too. So let's begin to the next question of ophthalmology. cherry red spot. As we all know, cherry red spot is seen in Tay-Sachs disease. This is like a PYQ, many times repeated question of FMG as well as other exams. This you can't do it wrong. Tay-Sachs disease, cherry red spot is seen. It is also seen in Gaucher disease also. But the most specific answer here would be Tay-Sachs only, not the Gaucher. So let's begin to the next question. Oil droplet cataract is seen in. As we all know, oil cataract is seen in galactosemia. There is a beautiful image you can see in the textbook or in the PDF. There is like this orange. I have not added the image of that oil droplet because the image was not provided there in the exam. It was like a one-line question only. Oil droplet is seen in galactosemia. In Gaucher disease, no. In Tay-Sachs disease, we can see cherry red spot. This was some of the one-line question we can see which came from ophthalmology, but it was all the PYQ questions only. It was also PYQ question, or we can say it is a like most repeated question. I hope so this question was correct for you guys, because these are some of the questions which you can't get wrong, because these are the questions only which will get you more than 150. So these are the questions only which we have to get it correct, not wrong, right guys? And as we all know, in galactosemia, there is a deficiency of GPUT, which means galactose phosphoryl transferase. This was a biochem part. You look at ophthalmology. I just covered it here. Now let's move to the next question. Vitamin A deficiency is associated with. As you all know, vitamin A deficiency causes night blindness, bright spot. Answer it will be. This is the, we can say, most important topic of all time in every exam about vitamin A deficiency. Sometimes they ask the WHO rating of bright spot like 1B like that, or 1A. What is 1A, 1B? But this time they ask vitamin deficiency is directly by dot question. As we all know, Stokes line. What is Stokes line? Stokes line is nothing else but the iron deposition in front of the pterygium, nothing else. So if you have to do the other options also like pinguela and pterygium on the Stokes line, you can definitely write the other options in this question, because it was like a very easy question, a very short question we can say. Vitamin deficiency is with by dot spot. So next we go to the next question. Question number 10. Curtain falling sign is seen. Curtain falling is sign in retinal detachment. And in particularly which detachment? Ligamentous retinal detachment. Particularly. If this was mentioned there, you can go for this word ligamentous retinal detachment. But if it was not mentioned, you can directly say retinal detachment, in which curtain falling sign is seen. So let's go to the next question then. Question number 11. Okay, let's do question number 11. Which nerve innervates the lateral rectus muscle? As we know, all the muscles of eye are supplied by nerve 3, except LR6 and SO4, which means the lateral rectus is by 6 nerve and superior oblique is by 4. Right guys? So to the right question we can say it was asked about lateral rectus muscle, and as you know the mnemonic, All the emissions are supplied by serial number 3 except for LR6 and SO4. LR is supplied by serial number 6. That question we can say it was a 6 no. If it was asked of superior oblique, then it has to be 4 no. And other muscles, any other, it has to be third no. Right, guys? Okay. So let's go to the next question. Question number 12. Okay, this question was, I think so, a little bit modern question we can say, because many of the students have marked the optic atrophy, or some of the students have marked their acute anterior uveitis. Okay, let's begin with the question. What could cause sudden loss of vision without fundal glow, with no history of trauma was mentioned? As said by some of the students, if there was no history of trauma, so they ruled out the vitreous hemorrhage, but it was not. As we can see, it clearly mentioned that there is no fundal glow. Without fundal glow, which means it has to be vitreous hemorrhage. Because in others like optic atrophy or acute glaucoma or acute anterior uveitis, there is a fundal glow present. But in vitreous hemorrhage, there is no without fundal glow. And as suggested by, there was no history of trauma, so it is, we can't say that there should be always a history of trauma in case of vitreous hemorrhage. There are many times there is no history of trauma for vitreous hemorrhage. Like vitreous hemorrhage is seen in basically is seen in mostly diabetic patient, and it is seen recurrent vitreous hemorrhage in those patients who have uncontrolled diabetes mellitus. In that patient, we can see recurrent vitreous hemorrhage, but in diabetes in DM patient only we see vitreous hemorrhage, and in that there is no fundal glow, and basically there is no history of trauma in every case. In some cases, okay, there is a history present, but not in every case. So this question was like a tricky question, we can say, because two part was mixed, like without fundal glow and no history of trauma. So the students were confused in this question. Okay, if you question wrong, we can't say you have to got all the questions correct, because you have to score more than 150 plus out of 300. You don't have to score full 300, right? So there will be some questions which you will get wrong. It's okay, because there will be some questions which you will get wrong. It's okay, because women make mistake only, and this is the mistake part which we can't do it anymore right now, because we have to get 50 plus, not less than this, right, guys? So if this question was a little bit trickier, we can say a little bit hard. Okay, if you get this wrong, but it is okay if you get it right, because if the question was right for this, I apologize. I think so you will score then more than 180 or 190, I guess, because if you have studied for this level, if you are getting this much level of question correct, then for sure you will get 180 or 190 plus, no doubt, because as we all know, the part 1 was very easy. Part 1 paper was like easy paper, easy to moderate, we can say. It all depends on part 2, how much you scored in part 2, which will be the total score of 10. And I know definitely many of the students will pass this time, no doubts, because the paper was not that much hard, or we can say that level where you should not score 150 marks. It was a good paper, like where you can score easily 150 to 160 marks, no doubt. So without wasting much time, let's move to the next question. Okay, this was a question like, as recalled by some of the students, it was mentioned that there were two different refractive powers, plus 5 diopter in one eye and plus 1 diopter in other eye. And the reason was mentioned that in right eye, or like we can say the left eye, some vision loss was there. As recalled by the students, reason was mentioned that, and it was asked the diagnosis of this case, and in that case there was a history of child. first of all, we will see what is the question. As there are mentioned two different vective errors, +5 diopter and +1 diopter. So it has to be an isometropic. Okay. Now next. And as suggested by, there was a vision loss present, like vision loss in right eye, we can say, or in left eye, was mentioned something. Any of this was present, so it has to be amblyopia. What is amblyopia? Amblyopia is the decreased eyesight due normal visual development. Okay, let's do this question. So, as we all know, anisometropic because of the +5 diopter and +1 diopter. Because if it is greater than 0.2, 0.5 diopter, it has to be anisometric. And as the vision loss was mentioned, it has to be amblyopia. So the answer should be an isometropic amblyopia. But as suggested by some of the students, there was no isometric amblyopia, or we can say there was amblyopia in the option. If it was in the option amblyopia, it has to be the answer. If it was not in the option, then of course amblyopia should be the answer. But if it was present anisometropic amblyopia, then for sure this is the answer. Okay, then let's move to the next question. Okay, the normal flora of conjunctiva. As we all know, the normal flora of conjunctiva is staph epidermis. Streptococcus pneumonia is not the normal flora of conjunctiva. It is basically of the nasopharynx. Whereas this is a common part of the nasopharynx and it is associated with respiratory infections. As we all know, Staph aureus is present in the skin and mucous membranes. It is not present in conjunctiva, or we can say it can be present in conjunctiva, but not that much as compared to Staph epidermidis. More often, we can say, more often present is Staph epidermidis than Staph aureus. And as you know, permanent diphtheria causes diphtheria. It is a possible agent of diphtheria, and it is not a part of normal flora. As you all can see, if you found this question a little bit tricky, so you can just rule out other options and you can get to the answer of Staph epidermidis by doing all the other options. Right, guys? Next we can do the next. So, as suggested by many students, like this was an instrument I reviewed this question. The instrument was asked. I don't know if this was a proper image or not, or this was a proper instrument or not. But as recalled and as by some of the students, we can say the answer here should be this from. I think so. In this case, a history was done. History was present of something like some chemical injury to the eye, because as we called in this question only the chemical injury was present to the eye, and we use the instrument for watering the eye as much as possible, so that as much as possible to remove the toxication. So this has to be Bowman's law. This is not the artery forceps, not keratome, not Weiss's scapula. Okay, guys. So now let's begin with the anatomy part. As you all know, anatomy was good this time, not that much hard. So let's begin the first question. What is the primary lymphoid organ? As we all know, what is the primary lymphoid organ? Primary organ is thymus and bone. As some of the students are saying thymus was present, some were saying bone marrow was there. So if any of these two options, one was there, thymus or bone marrow, it has to be done. And as you all know, lymph node and spleen is the second thing, lymphoid organ. Right, guys? So this was like an easy question, we can say. First of all, I will discuss about the ophthalmology. There were recalled like 15 questions was recalled of ophtha. And I hope so. More than 11 questions should be correct for you guys to have a good score. Because this was a scoring subject, ophtha, anesthesia, and PSM and ENT. This was the scoring course, I can say, because the questions was not that hard, or we can say not that much of that level where you can't score good. So for the good scoring, you must have to score ophtha, anesthesia, PSM, and ENT. So in this recall from 15 questions, you must correct 11 plus questions to get a good score. Right, guys? So let's back to anatomy. As we have already done the first question, primary lymphoid organ, and the answer was thymus. Okay, this was the image question. Anatomy, as we all know, anatomy was full of images this time. So let's do one of the images of the anatomy. Okay, so this is liver, this is stomach, this is spleen, this is left kidney, and this is right kidney. As suggested by some of the students, this point was asked. As we all know, this is connecting between spleen and left kidney. So it has to be splenorenal ligament. But this was not the options in the exam. The option was splenorenal ligament. So the answer here should be splenorenal ligament or the splenorenal ligament. Okay, let's do the other option. Where was this, and this? Okay, so this is the lesser momentum. You can see connecting between the liver and the stomach. And the connection between this stomach and spleen here, you can see. There is. Okay, let me show you. This point was asked. Which is splenorenal ligament. In this point, connection between the stomach and spleen. This one as gastrosplenic ligament. Gastrosplenic ligament. So if the arrow was here, it has to be analytical ligament, linear ligament, and if the arrow was here, it has to be gastrosplenic ligament. As recalled by most of the students, it was the arrow here between the left kidney and the spleen. So it has to be splenorenal ligament or the linear ligament. I hope so you have got this question correct. So the PYQ, I guess this was the PYQ question also. No chance of getting it wrong. Let's move on to the next question. It was a very easy question. Lining epithelium of the trachea. As you all know, the epithelium of the trachea is ciliated with a bit. No doubt, this was one of the easiest question we can say. Let's look at that columnar epithelium. So let's move to the next question. Question number 4. Okay. So anterior fontanelle possesses the vertex. As we all know, anterior fontanelle is also known as bregma. It is a diamond shape. It is the last one to close, and it closes around 18 to 24 months. So around this 18 to 24 months, we can say, as the options were not matching properly 18 to 24 months, but there was one option which was saying 13 to 24 months. It has to be the answer because it closes after 18 months and before 24 months. Only in this option we can say the answer was present. So it has to be 24 months. And if it was asked for posterior fontanelle, it is known as lambda. It closes first around 2 to 3 months. And it is the posterior fontanelle is present between the parietal and occipital lobes. Whereas this one is present between, the anterior one is present between parietal and frontal. So the answer here will be 24 months, no doubt. Let's move to the next question of anatomy. What is being examined in the image, or we can say there was a full history of this question. So as we all can see, the one leg is on the air and one leg is on the ground. So we are checking here for number. What happened in this sign? One foot is lifted over and one foot is placed on the ground, and we check for the hip drop. If there is hip drop is present or not. If the hip drop is present, then this triangular sign is positive. And when this triangular sign is positive, we check for superior gluteal nerve injury. Because this sign is positive in superior gluteal nerve injury. And when the superior gluteal nerve injury is there, we check for gluteus muscle. Gluteus, basically the medius and minimus. And the action done by gluteus muscle is of abduction. Abduction of X. So here we can say which is being examined here in the image is abduction. If it was present in the option, as recalled, some students were saying abduction was present, so the answer here will be abduction. Because we are saying for the triangular sign, we check for the hip drop, and in the hip drop, in the triangular sign, one foot is placed in the air, lifted up, and one foot is in the foot. And we check for the hip drop. If hip drop is present, then the triangular sign is positive. And in the hip drop is present, then we check for the superior gluteal nerve injury. And in superior gluteal nerve injury, there is a chance of gluteus muscles, and gluteus muscles are like gluteus minimus and gluteus minimus and gluteus medius. Gluteus medius, minimus. And the action done by this gluteus muscle is of hip abduction. So as we can see, we are checking for the abduction. Alright guys, this was like a tricky question we can say, because some were saying that there was no history provided, some were saying one image was provided, and some were saying some history was provided, like what is happening here or what is not. So I guess so you will not answer correct if you have done the anatomy of the hip drop perfectly. Okay, let's go to the next question. Which structure develops from the sixth pharyngeal arch on the left side? As recalled by many of the students, we can say they were saying left side was mentioned, and some were saying left side was not mentioned. It was a chart. The question was saying that which structure develops from the sixth pharyngeal arch. An image was provided, and there were, as suggested by the students, there were two arrows. One arrow was here and one arrow was here. If it was asked for sixth pharyngeal arch, if pulmonary artery was in the option, and it was asked for about sixth pharyngeal arch, and no left side was mentioned, just sixth pharyngeal arch was mentioned, and if pulmonary artery was in the option, the answer has to be pulmonary artery. But this was suggested by only some of the students, not many. Many students suggested that there was mention of the left side and there was no pulmonary artery in the option. So if left side was mentioned in the pharyngeal arch of 6, then the answer should be ductus arteriosus, because the left side of the 6th pharyngeal arch makes rise to ductus arteriosus. But if left side was not mentioned, as per some of the students, the left side was not mentioned, only the 6th pharyngeal arch was mentioned, the answer should be the pulmonary artery. So I hope so, because this was a confusing question for some of the guys, because 2 arrows were marked here, one here and one here. Two arrow was marked for left and for right, but in the exam left side was mentioned. For sure, left was mentioned. So the answer here should be ductus arteriosus. So now let's move to the next question. Okay, it is also I made the question. As you all know, in the anatomy, man you got the image only. At the arrow mark here, which ganglia is disturbed due to involvement of the nerve located at the arrow? Here as we all know, there is pterygopalatine ganglia. So when the nerve located here is damaged, ganglia which is disturbed is pterygopalatine. If it was mentioned, if the arrow was something marked here, then it has to be cortical. But the arrow was here, so it has to be pterygopalatine ganglia. These were the these are model questions, not that much hard. We have shared the images of the anatomy. Okay, now let's see this question. There was a person who fell on the outstretched hand and was injured and presented with pain and swelling at the base of the thumb. As suggested, at the base of the thumb is present of pain and swelling. So which bone is most likely to be fractured? This is one of the most important topics, or we can say most repeated question. Important plus repeated plus PYQ. Everything is there in this question. And you can't get this question wrong. The answer here is scapula. At the base of the thumb, scaphoid bone is the most common bone to fracture. Most common bone to, sorry, we can say most common metacarpal bone we can say to fracture is scapula. So, answer here should be scapula. Now, let's move to the next question. Question number. During patent ductus arteriosus surgical procedure, which structure is in closation to it which can be damaged? Which structure in closation? Okay. During the patent ductus arteriosus, as we mentioned, patent, it means it is a pediatric age group, or we can say neonate only. Not pediatric, basically. It is a neonate, as patent is mentioned. Which structure is in closation? So it is not a vein, not a nerve. It has to be laryngeal nerve only. Now which laryngeal nerve? Right or left? As recalled by some of the students. One second. Supraglottal nerve injury, yes, right. Artery was not there in the bilkul. Pulmonary artery was not in that option, because I was not in the options, right? Because it was only recalled by 1 or 2 students, not many. Many students recalled just this part, not the pulmonary artery. And that's the answer. Let us see. Next question. Pterygopalatine ganglia only. Then here scaphoid only. So now let's do this question. Patent ductus arteriosus. So here, as recalled by some of the students, they were saying only laryngeal nerve was there. No right or no left was mentioned. If no right or no left was mentioned, then this is the answer only. As we all know, laryngeal nerve is the answer. Now we are finding which is the answer, right or left. if right and left was in the option. So if right and left was in the option, the answer here should be left recurrent laryngeal nerve. Because as we all know, when rectal arteriosus is being formed, there is a left recurrent laryngeal nerve which comes and winds up around rectal arteriosus and it goes up. And the right recurrent laryngeal nerve, right one, is in close relation with subclavian, right? And the left one in close relation with ductus arteriosus in neonates, or we can say before that, and after that it becomes the ligamentum arteriosum. It is not right RLN, guys, not right, because as we all know, the path, as we have all learned the pathway of the ligament laryngeal nerve in ENT also, the left and the right, it comes like this and goes up like this, but the right one goes up because it is here at subclavian level. Left one comes down. If left and right was there, the answer is left. So in left recurrent laryngeal nerve, rectal arteries become ligamentum arteriosum, and we say the left recurrent laryngeal nerve winds up around at arch of aorta. So this is the only part of the arch of aorta where it winds around the left laryngeal nerve. So during the patent rectal arteriosus, we can say it is a neonate because it is a patent. So here answer should be left recurrent laryngeal nerve, not the right one, because the right has a close relation with the subclavian artery. I hope so. कोई नहीं, गलत हो गया तो चारों में गलत हो भी गए तो कोई दिक्कत की बात नहीं है. We don't have to get full 300. You have to just get greater than 150, right? You have to just pass the exam. 150 matters the most. Students who are getting 150 and 170, 180, 160, all are pass. All will then join internship, all will become good doctors. No worries about that. The first part is to qualify this screening exam, to score good marks like a 150 or 160 or anything, but you have to pass the exam. This is a screening exam, not a competitive exam like of NEET UG or NEET PG. It is not a competitive exam where you have to get the ranks. So also plus the very good. If 200 more than 200, not a, it's a very good thing. I hope so you will get more than 250 because you have done all the questions correct and you have it correct. So all the best, very all the best for the good, and I'm waiting for the results because I'm very sure about that. This time many students will pass, like the passing percentage will be greater than 40% this time for sure, I guess so, because the paper was not that much which you were thinking of that level will come, but the paper was like easy to moderate. So yes, let's continue to the studies and let's do the next question. Okay, question number 10. A person was climbing and he fell in an iron injury on the posterior triangle of the neck. Okay. And after the injury, the patient presented with loss of shrugging and difficulty in elevating the shoulder. So here the key points were marked was posterior triangle of neck. One second. Posterior triangle of neck, loss of shrugging and difficulty in elevating the shoulder. And it was asked which structure is most likely damaged, and the image was provided. As you can see, the shoulders here, the level of the shoulders, one is up and one is down. So which structure is most likely to be damaged? The answer here should be spinal accessory nerve. How? Let's begin. As you know, the key points were here: posterior triangle of the neck, injury in the posterior triangle of neck, and plus shrugging of shoulders and loss of elevation of shoulders. So here, most likely spinal, sorry, nerve is damaged. And all these features are suggestive of which muscle paralysis? Tell me, guys, in the chat. Which muscle paralysis? All these features: posterior triangle of neck, shrugging of shoulders, long variation of shoulder, spinal nerve damage. If posterior triangle mentioned नहीं था, if posterior triangle was mentioned, because many students were saying posterior triangle was mentioned, it might be in the first or second, like in the first time itself. We have not read the question correctly, or if it is also not okay, if it is also not mentioned the posterior triangle of neck, then also the loss of shrugging and between the shoulder, and by this we can say it is suggestive of accessory nerve injury, not deltoid, not long thoracic nerve, not the vagus of the sternocleidomastoid muscles. If it was mentioned, because it is a doubt which was present, this one or this one. Trapezius muscle paralysis, right? This is issue of trapezius muscles paralysis. And in trapezius muscle paralysis, in the trapezius muscles is supplied by accessory spinal nerve. So the answer here should be accessory spinal nerve. But spinal was not mentioned, I guess. Accessory nerve was there, so not a big issue. So answer here should be accessory spinal nerve. Now let's bring the next question. So it was mentioned that surgical procedure was going on a great saphenous vein, and the location was asked. Surgical procedure was going on, and on the great saphenous vein, the location was asked of the great saphenous vein. As we all know, the location of the great saphenous vein, where it is 2.5 centimeter anterior from where? Middle malleus or lateral malleus? So the answer is 2.5 centimeter from the middle malleus, as other options were like 2.5 centimeter posterior to middle malleus. Or let's say other options were there. It was like 2.5 or something like that. But the answer here should be accessory nerve was mentioned. Yes, accessory nerve was mentioned. It was answered. Here 2.5 centimeter anterior to the middle malleus. No doubt in this question, right, guys? So let's begin the next question. Question number 12. Okay, arrow marked segment of the knee. So this segment was marked. As we all know, there are 8 segments. Which classification, guys? Which classification divides into 8 segments? That is Coinots classification. Right, guys? So as you all know, the first is not visible in there, or it is another one. The second, third, this is the fourth A1, and this is the fourth B, and this one is fifth. So as you have already learned, 2, 3, 4, then 5, then 6, then 7 here, then 8 is this one. मैंने करा fifth वो we have, I think so, you have seen the arrow here. If you have marked the fifth, then you have seen the arrow here, but the arrow was up. So if the arrow was up, the answer will be 8. So this is the 8 segment classification of Coinots classification. This was marked, not this one, not this one. So this is the second, this third, this is 4th A, this 4th B, this 5th, this 6th, this 7th, this 8th. Right, guys? So the answer here will be 8. होता है वो, जितना क्वेश्चन रिवाइज करोगे, जितना बार प्रैक्टिस करोगे, उतना ही जाता है. So let's go to the next question. Question number 3. which structure is palpable. As you also, what is not the common perineum? It is not possible. Okay, I will give you a hint. This is a tibial artery. Now, which one? Which one is this? Anterior or posterior? इसका आंसर क्या लगाएगा? इस एंटीरियर लगाएगी, पोस्टीरियर लगाएगा? I will write two options for you. Not common, not dorsalis. The tibial artery. Which one? Anterior or posterior? Yes, it is a posterior tibial artery. It is a posterior tibial artery. And where it is palpable? Not a, it is posterior tibial artery, not anterior. It is palpable between the tell me guys, where it is palpable? Is medial malleus and Achilles tendon. And why we are checking, why we are palpating this tibial artery? We are palpating the tibial artery to check the blood flow of the foot, not the hand. We are checking the blood flow to the foot. The blood supply is good or not, the blood is going there or not, and what is the pressure of the blood going. Right guys, the answer should be posterior tibial artery. Let's move to the next question. Okay, there was a case present of there was an infection of the cavernous sinus, and it is involved in nerve on its middle side. As we all know, in cavernous sinus, the medial side, which nerve is there? There is abducens nerve. So from up to this line, you can take the next part to check the involvement of abducens nerve. So now they already present there is abducens nerve. So okay, we are going correct. To check the involvement of abducens nerve, you will ask patient to look which side. Now, as we all know, we have discussed in ophthalmology also, all the muscles are supplied by renal nerve 3 except LR6 and SO4. Right guys? And abduction is 6 now, and it is supplying the lateral rectus muscle. Right guys? And what is the function of the lateral rectus muscle? It is for the abduction of the eyeball. So for the abduction of the eyeball, we have to tell the patient to look at the lateral side. For the involvement of the abduction nerve, we will tell the patient to look at the lateral side to check the abduction nerve is working or not, and if it is damaged or not. Then there is an infection in the cavernous sinus. So the answer here will be lateral side. You will ask the patient to look the lateral side. Here, like some eye was mentioned, right eye or left eye, something like that. Where this patient should see laterally or medially, like something case was mentioned here. Not the perfect question was. This is a recall session, guys. This is a recall. This is not the exact question which came in exam. This is a recall which we have recalled from the students, which when they have given the exam, and this is not the exact lining of the questions. We can say question was not there. This question was recalled by many of the students, I guess. Lateral side, yeah. See, some students are saying the answer also. It was a case presenting question. It was not a directly question like infection of the cavernous sinus. So the lining of the question was not like this. I think so. The lining was something different, but the question was something like this only, which was asking the superior, inferior, middle, or lateral. 4 options was present here, like this only. Okay. Let's move to the next question. Okay. This is a very, I guess so. This is the question which is not recalled properly yet. because the answer here is not getting, because question is not recalled. Some are saying something, some are saying something. So depending on that, the answers are fluctuating. The answers can be any. Okay, let's begin the question first. Question presented to the hospital where he was able to flex at metacarpophalangeal joint and able to extend the interphalangeal joint. And something was mentioned like he was not able to pin thumbs. Okay. Posterior inter. Yes, no. Let's see what is the answer here. Firstly, we will begin with the question. So, a patient presented to the hospital where he was able to flex at the metacarpophalangeal joint and able to extend the interphalangeal joint. And nerve was asked, which is the damaged one. So, first of all, let's see. As he is able to flex at the metacarpophalangeal joint, he can able to flex the metacarpophalangeal joint and extend interphalangeal joint. And if the history of mention like the wrist joint is flexion and extension is okay, the flexion and extension of the wrist joint is okay, so it must be a hand drop. Then the answer here should be posterior interosseous nerve, as you are saying. Finger drop was given, right? Hand drop, finger drop. Then the answer should be posterior interosseous nerve. Another way is not the answer. This is not the answer. And if something was mentioned, this finger, this, or this, any of the three, then the answer is anterior interosseous nerve. If this was mentioned, if this was not mentioned, answer can be radial nerve also. All the nerves and no history of this hand drop. Oh, sorry, there is no history of wrist movement. If there is no history of wrist movement history was not there, then answer can be radial nerve. And if the injury was there at thumb, index finger, or the middle finger, then it should be the anterior interosseous nerve. So it all depends what was actually given in the question. So it is very difficult to get a proper answer of this question. I can suggest, because someone was mentioning there was no anterior or posterior interosseous nerve was mentioned. So if interosseous nerve was mentioned, then, and if there is a history of like finger drop was given or hand drop was given like that, history was there, then it has to be interosseous nerve for sure. If history was there of hand drop or we can say of finger drop, then it has to be interosseous nerve itself. But someone was saying there was anterior interosseous nerve. But if it was anterior interosseous nerve, then only this and this, not this last two. But nobody was mentioning that the full hand was there, only some fingers was there. So AIN was ruled out by this. So the answer should be radial nerve here. But if finger drop was given, then the answer should be PIN. And if no history was given and no such history of like wrist joint movement, then the should be of radial nerve. So both answer can be here and posterior interosseous nerve. It all depends what was there on the question. Given anterior interosseous nerve was not given. Okay, if anterior was not given, let me take it. But wait a second. Anterior was not given. Posterior was given. Okay, posterior interosseous nerve was given and finger drop was present. So I will suggest the answer should here will be posterior interosseous nerve. But if it was not there, then the answer will be radial nerve. It all depends on the recall, guys. What you are recalling, because as recalled by many, some are saying, half of the students are saying it was there and half of the students saying it was not there. So we have to take both the pathway there, right, guys? That's why I marked the question mark here, because this is some tricky question, or we can say it is not recalled properly. So let's begin to the next question. Question number 16. This was, I can guess, nobody will get it wrong. No one. If you ever have studied a 1 day before exam also, na, like if a student is studying 1 day before exam also, and he or she is studying just the PYQ or the PYTs or just imagine something and if he has studied something in his past colleges, something like that of anatomy, he can't get this answer wrong anyhow. Right? This is the PYQ, this is the PYT. This image is only there with them. This image only comes. CS progress section was there, right? Right, guys? I will not mark the answer for you guys for this question, right? Because I know everyone here have got the answer correction, right? So here is internal terms. Not for it, not say internal capsule. Yeah, right. Internal capsule not comes. Let's move to the next question. Okay, this was like we can say anatomy question only. Endoscope has reached 25 centimeter from the inside of the, and the landmass was asked which it has crossed or it has reached till 25. As we all know, there are three surgical landmarks. Right, guys? First one is pharyngeal, position at 15 centimeter. Then there is arch of aorta. Some books suggest it is 23, but some suggest 25. Anyhow, between 20 to 25 centimeter was there. And the last is diaphragm at 40 centimeter. But there is one more landmark that is not surgically, it is physiological landmark, that is left bronch. Fourth one, which is at 28. But sometimes this is merged with this only, like arch of aorta and left bronch is 25 centimeter itself. So here it was asked for endoscope has reached 25 centimeter. So the respective landmark was asked, and the answer should be arch of aorta. Trachea is not, diaphragm is at 40, left bronch is at 28. So from 25 centimeter, if arch of aorta is at 23 also, we can say that if it is 23 also, then also it has passed the arch of aorta. It has reached 25 centimeter. We can say. I hope so. This was an easy question for you. Like the last question, this was very easy, and this is very easy question. Okay, guys, let's move to the next question. Question number 18. So this, I think so, we have done in the ophtha part. After surgical procedure, patient presented with lag of thymus. And nerve was asked, which is most likely to be damaged. As you already covered this part about lag of thymus in the ophtha. Right now we have studied, it was around third or fourth question was there, I guess. The answer here is 7. And guys, lag of thymus is inability to close the eyes. Muscle responsible is orbicularis oculi, led by seventh nerve. So in any facial nerve palsy, there will be lag of thymus. Right, guys? The answer should be 7. So let's move to the next question. Okay, this question was there about joints. So every time a question definitely comes about joint. So this time it was like a model question, we can say. Joint between epiphysis and diaphysis of a long bone was asked. So what is present between the epiphysis and diaphysis is the epiphyseal